Imagine, imagine you're halting in a very beautiful remote village of a developing country. Suddenly, one of your family members gets ill. You try to reach out to the physician or hospital. They are miles away. You try telemedicine while the internet is either too unstable or even non-existent. Your mind's racing, and then you realize the antihypertensive medication this member was taking is out of stock. What would you do? Well, this isn't just a hypothetical situation, and if you think this isn't even real, let me tell you, this is the only reality that millions of people are living in these low and middle income countries. A poor mother hardly saves her child from various infectious diseases like measles, malaria, or pneumonia, but she may not be fortunate enough to save her young, productive son who dies at the age of just 30 or 35 because of a cardiovascular disease. And what's more painful is that this mother doesn't even know the cause of the death, because most of the cases of heart attack or vascular events do not even reach hospitals. Why? Because the health facilities are far away, people are unaware of the risks or symptoms, and the cost of the private health care. They're often very prohibitive. The central question remains, what would you do? Well, this is really very difficult situation, but then we believe we have a cost-effective solution in reaching out these unreached populations, and that is mobilizing community health workers. And these community health workers are community volunteers who would educate people on the risk factors. They will not only link you to the health facilities, but also deliver medicines at your doorsteps. How wonderful it is! But a problem associated with this approach is that these health workers aren't professional health workers and often require support. One approach would be to use a mobile app. Now, how good it is that this app will enable these community health workers to test blood pressure, blood glucose, heart rate to footstep. Wouldn't that be promising? But then if you still think, will that have a long-term effect? That's exactly what my research is investigating into. Identifying and informing policymakers on ways and means of making this community-based, human-centric approach sustainable. Allow me to remind that larger public health gains has been through small, little, doable actions such as removing a pinch of salt from your food can avoid 2.3 million deaths, meaning this mother would be now enjoying her old age with a son, daughter, or even grandchildren only if we could have communicated the risk effectively. Thank you.